Hi, my name is Srdjan. I'm a physician assistant in family medicine. I'm excited to talk to you about my 4 top tips in acute back pain, such non-traumatic acute back pain, such as if you were to wake up in the morning and you experienced back pain, or if you were to reach for something and you experience some back pain. For tip number 1, I recommend starting out with heat. And again, if this is a non-traumatic back pain, again, where you're waking up with some back pain in the morning, or you happen to reach for something and you experienced some back pain or realized you had back pain, again, starting with heat will be very appropriate. The heat's gonna applying heat to the region will warm the region, will draw some circulation and help provide some healing. If that's providing relief, that's wonderful. I would recommend doing that for 20 minutes on, 20 minutes off. However, if that's not providing the relief that you're hoping for, you can always add some, alternate with ice, doing heat 20 minutes and 20 minutes off, and applying ice 20 minutes off. Essentially what the ice is going to do is going to cool the region, and that's how it's going to help provide pain relief. Important thing with the ice though, after you've iced a region on your back, and if you happen to want to be active after that, I would recommend warming yourself up slowly, because the ice will, when applying ice to a region, it's going to constrict the muscles. And if you happen to move too fast, you can further injure that region. So again, just being careful after applying the ice. For tip number 2, I highly recommend, again, if you have that non-traumatic back pain, acute back pain, being active. And what I mean by that is you don't want to be resting in bed thinking that's going to help ease the pain. In contrary belief, we actually want to be active, moving. Again, not like running or being super active to induce more pain, but just walking around, doing some light stretches, and just going for light walks. Research shows that if we're individuals who are more active with back pain actually have see more relief. Individuals that are not as active or more at bed rest actually accumulate more pain with their already acute back pain. For tip number 3, I would recommend doing some basic yoga poses, such as the cat and cow pose. These are some basic light stretches for your lower and mid back. Doing these poses, I recommend holding them for 5 seconds and then repeating 12 times. And doing them twice a day, preferably morning and evening, and incorporating this on a daily basis. I also recommend following your pain. Essentially what I mean by that is you don't want to go past your pain point, but you do want to give it an effort and give it a try. For tip number 4, I recommend seeking help from a healthcare provider and physical therapy if your back pain persists into week number 2. If your back pain is worsening, and especially if you're having symptoms, pains radiating into your legs with your back pain. Being able to have direction from a healthcare provider and a physical therapist will provide you with different treatment modalities and appropriate diagnoses for your acute back pain. We look forward to working with you to help you achieve your goals.